Hey there. Hey, I'm so glad you could make it today. All right. See, time for your annual checkup. So what has been the problem? Has there been any particular problem, or are you just here for a checkup? Okay, let's have a look. I'm gonna just look quickly right now with my, just have a look here. Sit still for a second. I'm just gonna see if your pupils are dilating. In a minute I'll just turn off all the lights, but let's see. I just want to make sure your pupils are dilating fine. All right. Now the nurse outside, I know she asked you all the basic questions. If there's a history of glaucoma in your family, you said there are some in some of your far removed relatives had glaucoma. Okay, that's good to know. Although if they're not direct family members, you know, along your direct paternal or maternal line, it's less likely that you'll be afflicted by it. But all right, well, we'll just have a quick look right here. How far down are you able to read clearly? How about this line? Good. Good. Is it getting... You want me to help point it out? How about if there's some light on it? Is that easier? Line 5. Can you see you can see the 5. All right. That's getting more difficult for you. Okay. Well, put your glasses on. Here, you had given them to me a second ago. Put them on. There you go. Thanks. Put those on. Here, let me just help you. I'll put them on for you. There we are. Make sure that they're... Okay. Good. Can you see a little better now? All right. What happened to my light? Here it is. Okay, we don't need the light right now. So with your glasses now, you're able to see that line, that line, and this one's getting a little blurrier. Okay. So as of last year, you were able to read this line very easily, and now you're still able to read it, but it's not quite as clear as you believe it was last year. And then this one is just too blurry. So you've developed, you know, your vision it's gotten worse. I was trying to find a nicer way to put it, but your vision has deteriorated. That's right. Because at 20 feet away, which is roughly, you're even closer than 20 feet, you should be able to read this line perfectly with your glasses on. That would mean you had 20/20 vision, but you don't. You're even closer than 20 feet, and you're still not able to read it, so you're going to have, you know, a different prescription than you did last year. All right, so I'm just going to, let's try this now with the lights off, because what happens when the lights are off, your pupils dilate, and maybe it will get a little clearer. So we'll compare your night vision with your day vision. Okay, so give me a second. Turn off the lights. Okay, now we're going to need some light here. All right, now I do see that your pupils dilate nicely when I shine the light into them. Rather, they don't dilate, they get smaller. And when there's no light, the pupils are dilated. So now where I'm shining the light, tell me what letters you see. This one. Okay, that one. Here we go. And let's just start with the line where we started having the trouble, line 7. Okay, right there. This line, I know it's hard to see with me. Okay, so it's a little clearer now, line 7. Okay, just a minute. I'm just gonna put this over your eye, How about that now? Okay. How does that look? Is that better or is that better? Okay, is that better or is that better? You want me to do it again? This or this? Let me have a look. I think you might have some blood vessels that are starting to swell. All right, I'm just gonna look here, there. Okay. I'm not sure that I'm a little concerned about a blood vessel that I see here when I lift your eyelid. I'm just lifting your eyelid. Yeah, there's a blood vessel there. It's very red and big on the inner side of your lid, on the inside of your eyeball, which could be putting a little bit of pressure on your vision. But it could be that we just have to watch it. It doesn't mean it's any big deal. All right, now we're gonna put the glaucoma machine on you. And you're just gonna feel a little puff of air. It's a very special glaucoma machine that I bought. It's very expensive. Okay. You're just gonna see some stripes. Okay, now, first in this eye. Oh yeah, I know it's a little bit scary. And now we're gonna put a puff of air in your other eye. Okay, good. I know it leaves your eyes a little bit dry. All right. Okay, I'm gonna turn the lights back on. Just relax. If you want to close your eyes so that they lubricate again. I know that puff of air is a little uncomfortable. I like to use natural light for my examinations. All right, it's not too bad. Let me just have a look here at your. I'm just looking inside your glasses now. Here, let me just have a look here. Yeah, they're a little bent. Did you sit on them? Yeah, I know. We could probably have them fix it in our shop. You know, it'll only take a minute. We don't want to leave you without glasses while we have your new prescription filled. But these are really crooked. And that, when you're wearing them, you see they're on your face crooked and it could cause some distortion. Let me just clean them for you. All right. So on your way out, stop at the front desk and ask them to straighten them out for you. Yeah. Here you go. Let's put them back on. All right. Does it tickle the bridge of your nose? Yeah, we sell some special pads also that you can put there on the nose rest. I think, yeah, it's looking okay. It's looking okay. I'm not sure if we need to. All right, well, I'm not too concerned. Let's try a few more things. I'm going to put these drops in. These will dilate your pupils. So you're going to see kind of blurry in a while. But let's put these drops in. Look up. Let's put these in. Okay. Look up. We're just going to drop a little in. Okay, now blink. Let me get you a tissue to dry off the excess. I'm sorry about that. Yeah, don't touch it with your fingers because just dry underneath your eye. I'll do it. We're just going to blot it. We don't want to get the drops out of your eyes. Okay, now we'll do this eye. Okay, good. There we go. And blot it. There we go. Okay. We don't want you to lose the drops. The drops are lubricant drops as well as dilation drops. Pure moist. They also disinfect your contact lenses. Would you like to get contact lenses as well today? You would? Good. So let me have a look again in your... Now through the magnifying glass, I just wanted to see that blood vessel one more time. We don't want it to get any bigger. Now, we'll watch this. I would suggest you come back in about 6 months just to have a look again at the blood vessel. I'm going to make note now of the size. We're going to measure it, and then we'll see if it increases in 6 months or so. There we go. Oh, good. Okay. All right. It's very small. It's a few millimeters. Now, in 6 months, we'll have another look at it. If it grows any more, we might decide it's a cause for concern and suggest surgery or laser treatment just to keep it under control. All right. Now, the redness is most likely caused by, you use the computer a lot, you mentioned on your questionnaire. The computer burns your eyes. It burns the cones inside your eyes. So you really should put on like a screen protector. There's sort of, it makes it a little bit dimmer, or you can turn the light down on the computer, just make it less bright. You know, you might have to get used to having to maybe focus a little more. And that could give you headaches as well. But the computers are not very good for your eyes. You're on the computer all day at work, I know, and then most of us go home and we're on Facebook or YouTube or one of the other social medias, and we're on that for a few hours. So Americans are spending more and more time on the computer, and in turn that is affecting our eyesight and our eyes. It's making them red and irritated and itchy, and some of us develop allergic-like symptoms. It doesn't mean we have allergies, but they're very similar to allergy symptoms. And the only thing I can suggest is putting a screensaver, or use your sunglasses when you're using the computer. If you really like it to be bright, put the sunglasses. It's sort of, instead of putting the protector on the computer screen, you're putting it on your own eyes, and that helps also if you're using other people's computers and you don't want to be fiddling with their brightness of their screen. You can just use, we have special sunglasses that we sell on your way out if you'd like to have a look at them, and we actually have a pair that's free. They're made of cardboard. The lady at the front desk has a pair. She'll give them to you on the way out, because your pupils are dilated. The sun is going to seem very bright to you when you leave. I'd like you to come back in 6 months. Of course, I've got your prescription now. We're going to make you a new pair of glasses. Go outside and pick the frames, and check back with us in 6 months, so we can have a look at that blood vessel. Your glasses should be ready in about a week. Yeah, we send them out for them to grind the lenses and make them just your right. Would you like bifocals? The ones that change slowly, not the one with the line through the middle. And you'd also like contact lenses. I agree. Because contact lenses are nice for when you're going out, with friends or to a party. And glasses are for when you're at work. It's nice to be able to take them off and rest your eyes sometimes, rest your eyesight. But for parties and things like that, you like to have contact lenses. I know. I use both. I use glasses and contact lenses. Good. All right, well, it was really nice seeing you. I hope you'll come back again. Right. Okay, check with the nurse on your way out. Thanks. Bye.